Welcome, stroke warriors, TBI warriors, and care partners everywhere. Welcome back to Stroke Warrior Radio, where warriors achieve victories every day. I'm your host, Ralph Cortese, and today I have a very special guest joining us from Neuro Access Rehabilitation Services. Oh, I'm proud of myself. I did
It's a
that.
mouthful.
It's a program dedicated to help stroke and brain injury survivors continue recovery in their homes, clinics, and adaptive gyms. Their approach, and we'll get into it a little more, is I was interested in talking to our guests about their approach on compassion, dedication, and excellence, meeting survivors where they are and helping them regain their independence. Please welcome Kelsey Harris. Hi, Kelsey. How are you?
I'm good, Ralph. How are you? Thank you for having me on, and thank you for putting on such a wonderful program for the stroke survivor community. It's a much
Well,
needed
thank you.
service that I'd love to see
Thank
getting
you.
filled.
It's a pleasure doing it. I mean, I do it because I didn't know what I didn't know, and I want to make sure other people don't have to go through that.
Absolutely.
So you're a physical therapist, doctor of physical therapy. What is CSRS?
It is a certified stroke rehabilitation specialist. Make sure I said
Thank
that
you.
correctly. Yes,
I, I thought I knew that, but I figured I better ask. And you're also the CEO of Neuro Access Rehabilitation Services.
I
Can you
am.
share a little bit about your personal and professional background and what inspired you to get involved in neuro rehab?
Absolutely. So I'm a physical therapist by background, and I always make sure that when I tell people what I do, I always say I'm a physical therapist first. And yes, I also own Neuro Access Rehab, but being a physical therapist is the root and the core of who I am. I fell in love with stroke and brain injury recovery very early in my career and started that specialization path. And as I'm sure most of us listening to this will probably agree, I got very frustrated in our healthcare system today, and that is not a hard thing to do. But I saw that, we know with science what is the best resources and ways to help people, but our healthcare system limited my ability as a therapist to help my patients. I knew that I could help them get better. I knew that if I did X, Y, and Z, I would be able to help them maximize their recovery. But our healthcare system didn't allow me to do that. So, out of pure frustration, I started Neuro Access Rehab almost 4 years ago to be able to offer our clients, our stroke survivors out in the community, the care that they deserve to have access to.
Yeah, I know this isn't kind of in our outline of what we want to talk about, but what do you see the restrictions? What were those restrictions that are causing it? Is it insurance? Is it protocols? Is it what is
I would
caused
say
that?
both. It's a systemic, in my opinion, a systemic issue from our insurance regulatories of not just at, funding levels, but also from local levels of what we're able to offer our patients, and that comes back to what's being reimbursed. So every clinic, every company, every healthcare system provides what I consider financially driven care. How many patients can we get through this system as quickly as possible to make a bigger bottom line, get our profit bigger? And that's just at the sacrifice and the cost of the patient. And that is, to me, the biggest kind of issue, we'll say, in
Yeah.
our healthcare system, the delivery of service, because that puts then therapists, myself included, at a time that I have productivity standards that I had to meet that depended. If I didn't hit them, I wasn't getting paid. I have, to see multiple patients at the same time because I have to hit these productivity standards. And now that's taking away my care that I know I need to give to patients. But from a
Hmm.
healthcare system standpoint, they have to put those productivity systems in place because as therapists, our reimbursement is so low. The only way that big healthcare systems make the most money is by adding all of these, visits and multiple patients on to a therapist at the same time. And it takes away our autonomy as practitioners and therapists to be able to give patients what they need to have. And then from a therapist standpoint, it just drives burnout. So it doesn't matter how great your therapist is. If they're exhausted and seeing 8 people at once and juggling 8 different things, they're not going to be the best version of themselves for the patient. And so
Never
both of
realized
those
that.
things, yeah,
You
both of
really
those
see
things
that
I
many
think contribute.
patients at once?
I don't, and we don't at Neuro
Oh,
Access.
yeah.
We see one at a time, but there are a lot of standard outpatient clinics, different healthcare systems, and it's not just outpatient, there are different quotas that need to be met all throughout healthcare of patients, multiple patients being seen at once.
I didn't know that.
Mhm.
No wonder I was so angry at my therapist for so long.
Yeah, and it may not have been their choice. They have rules and guidelines that their bosses, their clinic directors are implementing that can oftentimes, force multiple patients to be seen at once because of a ever declining healthcare reimbursement. So for them to that clinic to hit their bottom line, they've got to have more patients. And I didn't and do not support that. So that's why we started Neuro Access to be able to give truly patient-centered care, not financially driven care.
Is that what makes NeuroAccess so unique to other rehab services?
I think there's a few things. That certainly is one, Ralph, that the root of all of our decisions, the root of every decision that I make, and that's why I always say I'm a physical therapist and I own Neuro Access Rehab. I'm not just the owner of Neuro Access because I'm a physical therapist first, because I put patient-centered care at this forefront of every decision that we make. And that is one thing that certainly makes us different. All of our team members are neuro specialists to some degree. So they either have years of experience in the neuro field, they have neuro specializations like my stroke specialization. We have some therapists that are neuro certified, board certified therapists in neurology. We all have specialization after our doctorate degrees. We went on and got further specialization in neuro recovery because it is so different. And then I would say the third thing that makes us unique is that we come to you. You know, um,
Oh,
we're a mobile outpatient therapy company, so that means that we get to bill outpatient therapy insurance. We just come directly to you in your environment to work on making you as independent as possible in your home environment.
very cool.
Yeah.
Your mission, as I mentioned in the introduction, emphasizes compassion, dedication, and excellence. How do you live those values day to day with your patients?
It's a great question. I think compassion is it is very important to me that I bring the right team members onto our group, and I am very picky with who we bring on because they need to be good people first. We can always teach knowledge and skill. We've put people through mentorship programs. I will continue to do that. But being a good person and being compassionate and empathetic and understanding that the people that we're working with have just been through the worst thing in their lives most of the times. They just had their worlds flipped upside down. So being able to be there and empathize and listen and just hear them out and kind of meet them where they're at is crucial for what we do. Um, the excellence aspect of our approach is we are always making sure that we are at the forefront of what is new in research and science and implementing the 10 principles of neuroplasticity because we know with evidence that's what works. So we're every team member across the board, we stay up to date with what is the highest level of evidence of what we should be doing for stroke survivors right now, and then making sure that that is what we are implementing to optimize a stroke survivor's recovery potential.
I'm I didn't realize and I didn't know for several years after my stroke. So I'm 10 years this month. So several years after my stroke, I didn't know there was a difference between a physical therapist and a neuro rehab. What does that
Yeah.
mean?
Yeah, the best way that I describe this is I love my family care doctor. I would not want my family care doctor doing my brain surgery, right? Like that's scary to think about. Just like you wouldn't
Yeah,
want your brain surgeon doing your hip surgery. At med school, everyone goes and they learn everything in school, but then physicians specialize and they say, this is what I own. I am great at this. That's what we do, and that's really what you want to find in a neurotherapist is someone that we learned everything in school. When I went to PT school, we learned everything. I learned orthopedic and cardio pulm, and everything has a place, and it all is integrated together. But we recognize that we truly specialize in neuro recovery because it is a different approach than say someone that's had a knee replacement or someone that's recovering from a sports injury. The training principles, if you will, are very different for the two separate conditions and oftentimes vary within neurologic conditions. You can't take the same approach for someone that has had a stroke versus someone that has multiple sclerosis versus someone that has ALS. They're all different approaches that typically only individuals that specialize in this are the most equipped to treat and handle.
That explains a lot about some of my therapists put me on a bike and walking away. They
Exactly.
didn't, they didn't
That's not what
understand
was,
it.
yeah, not what was best for you at that time.
Wow. Who are the patients you serve? I mean, you do stroke, spinal cord, brain injury, and beyond, right? I mean,
Yeah, anyone that
not
has a
just neuro.
neuromuscular or neurodegenerative condition. So anything that affects your brain, your spinal cord, like you were mentioning, stroke, brain injury, spinal cord injury, ALS, MS, Parkinson's disease. We have some Huntington's disease. A lot of the rare neuromuscular and neurodegenerative conditions our team works with. And if anyone, has something that's different and they're not sure, I always say, well, reach out. We can read it. And if we're not the best person for you, we then refer you to someone who is. And we have connections throughout our area of saying, hey, I am not the best. I am not going to do you the justice that you need, but this person is going to be the best to help you. So even if we're not someone to help, we'll get you connected with an expert in your condition.
You provide therapy in homes, clinics, and adaptive gyms, which I want to
Yes.
get into that a little more. But how do these settings differ and benefit survivors?
Absolutely. So I set us up to be able to help bridge the gap between home and community integration. So we are able, right when someone comes home from the hospital, we come in, we meet you in your home, we do therapy and help you become independent within your home setting. Once you get independent within your home setting, most times you don't want your recovery to stop there. Everyone wants to keep going and doing more. So then I've set us up to be inside of an adaptive gym. So we've partnered with a fantastic adaptive gym. They're called Life in Motion. We once we see you at home, once you and your therapist determine that, like, hey, I'm ready to get out of the clinic or get into the clinic, I'm doing good in my house, we then transition and see you in the clinic, just like a standard outpatient therapy clinic would on the corner, regular therapy clinic site. But what's special about us is that we're inside of that adaptive gym. So the goal with that is that you're going to come and see us for therapy. But then when you no longer need us in therapy, we still want you coming to that same exact gym, just you're going to see the adaptive fitness professionals who are trained in neurotherapy and recovery, continued recovery, so that they're able to continue the recovery journey. Because for some people, they might need a little bit of assistance walking or using a machine or transferring onto the bike. But if you go to a standard, say, Planet Fitness, those machines might not always be accessible and easy to get on. Or if you're in a wheelchair, you can't just roll right up to the machine because there's a seat there that's fixed
Right.
seat. So we're partnered with an adaptive gym that is fully accessible for people of all mobility levels. And the individuals and staff members that work there are specialized in continued neuro recovery and fitness after any type of injury. So it's a beautiful pathway and transition to encourage people to stay active and involved out in their community after they've made incredible recoveries, to keep their progress and momentum going.
What an incredible concept. I love
Yeah.
that. You describe your therapy as functional activity based. What does that mean for a stroke or TBI survivor in their daily life?
It is working on things that you have to do every day. Nothing makes me more frustrated when I go into a clinic and we have someone who, let's say, an older gentleman had a stroke and is working on picking up little beads. Beads mean nothing to that person unless they have grandkids and they're making like new Taylor Swift friendship bracelets or something. But most times People don't want to be working on picking up little beads, but maybe they love working in the shop. So we need to be using nuts and bolts. We need to find
Okay.
things that are important to them and work on those functional and activity based to each person. What is important to you? We need to be working on those things because it will improve what's called salience. That's your brain's ability to release special chemicals like neuromodulators in the brain to help optimize your chance of and potential with recovery. So working on those tasks that you're doing every single day, if you want to be able to stand and walk, then we need to work on standing and walking, not sitting in a chair and kicking your leg back and forth or moving your ankle up and down. There needs to be the actual activities that you want to work on in your home environment from your chair to make you independent in that environment.
I think I told you a story about one of my best physical therapists. I was in construction before. She brought in a 4-foot step ladder so I
Yeah.
can relearn how to get on a step ladder.
Exactly. It's things like that and that probably meant so much to you, right, Ralph?
Oh my God,
Like,
she
yes, this is
cared.
it. This is what I want to do. She cared. And I think that there's so many therapists out there who really do care. So many fantastic therapists across the country that really, really care and have this tools and knowledge to that are great neurotherapists. It's just letting stroke survivors and those great therapists get connected in one to be
Yep.
able to work together.
It's a stroke survivor person. I mean, it just, it took me a while again to realize that I could fire my physical therapist. You know,
Absolutely.
I I actually went out and interviewed therapists. I went out and visited their locations to
Yeah,
see
to
what it
see.
was like.
I think that's a
And
wonderful
so
idea.
many stroke survivors don't ever know that.
Yeah.
I mean, it's something that they need to know,
And like I
I
love
think.
that you mentioned, the stroke survivor as a person because yes, this someone had a stroke, but that's not who they are at the core. It's finding out who Ralph is. What does Ralph like to do? Yes, Ralph had a stroke. Okay. But what does Ralph like to do so that we can help now the Ralph that had a stroke get back to doing all the things that they did before? You're still you. You just had a stroke, and we need to help you get back to doing all the things that you still love to do.
And one of the things that I think is so interesting about your concept is that you allow space for people to ask questions. You know,
Absolutely.
I somebody told me a long time ago, the only dumb question is the one you don't ask.
Yeah.
And once I realized that, started asking silly questions, and I started getting good answers about, yeah, here's something we can try instead. Those kind of things. And I like that about your organization. What is some of the challenges that survivors often face that they weren't told they were going to face once they leave the hospital?
I think there's so many.
Yeah,
Um, I think
just a
that,
few.
yeah, I think the biggest one is when you get home, you've had this awful thing happen and people are in the hospital and everyone just wants to get back home and I am with you on that. Home is comfort. And then you get home and then you see you're in your home environment and you see all the things that the last time you were here I could do all of these and now I can't. And it's kind of that like gut-wrenching reminder that I did have this massive stroke and I can't get up and go to the bathroom how I did before the last time I was here. I see that pile of laundry that I wanted to put away and then I had my stroke and I never got to put it away and now I can't. And I think the biggest part that we've seen and that we've experienced with some of our stroke survivors is the mental aspect that you oftentimes can't prepare yourself for of coming home to that, oh, like you're reminded of all the things in a very awful way that I can't be doing these. But that's I guess also the great part about where we come in and say, okay, show me and tell me where those frustration points are in here, and let's work together to get them accomplished and to decrease your frustration and improve your independence with things. But I think that's one of the biggest things that a lot of our stroke survivors aren't always prepared for is the mental aspect and change of seeing things when you get back into the home.
Yeah, it's again the neurophysical therapist. It's a difference between going to a workers' comp physical therapist and
Yeah,
recognizing all the other things other than just the physical.
absolutely.
It how do you help bridge that gap during the transition from a hospital to home? Because so many stroke survivors go home and that's it.
Yeah,
You
it's
know, they
crazy.
don't realize what's the consistency to repetitiveness. You still have to keep doing this. How do
Yeah.
you bridge that
And
gap?
and I think that that's another flaw of our healthcare system and something I heard a lot of people and stroke survivors tell us when we get in and work with them is, they stopped my home health therapy and I was told that when I get strong enough, then come and see, then I can go to outpatient therapy. So they're not strong enough to get to outpatient therapy, but then you're going to take away all the resources to allow them to get strong enough to get to outpatient therapy. Like that doesn't make
It,
sense, right?
it, it
So
doesn't compute.
yeah, like something's not adding up here. Um, which is why I made us this mobile site to kind of bridge the gap between the two. But our company, our team works with helping people figure out that transition of I'm in the hospital or maybe I'm in a rehab or a skilled nursing home and my goal is to get home. Okay, how can we make this happen? Just before I hopped on the call with you, Ralph, I was talking to a gentleman who had a massive stroke and he and his daughter, he's in a facility. How can we get him out of there? What is the game plan? And where he's at, he's not getting the neuro high intense therapy. He should be doing so much more than he is. So we had a call on how we can brainstorm and work together to get him to back into inpatient rehab and then then maybe back home and how we can help support this stroke survivor in his recovery journey because as I'm sure you know it is a journey. It never happens as fast as we want it to, and that's us
Yeah.
as therapists included. So
Oh,
how we
yeah,
can
good
kind of
point.
help support that the entire way. And I think a perfect example and a wonderful success story of this is we were contacted right after someone had had a stroke. Their father had just had a stroke and she was like, I don't know. I heard about you guys. What do we do? We stayed in touch with this family and helped guide their recovery and just give advice and listen from acute care immediately in the ICU having a stroke. He went to a nursing home. Then we helped get him into inpatient rehab. He wasn't able to get home yet, so he's at an assisted living facility right now, and our team has been working with him and we're getting him back home. And it's so for me it's so nice to see that there is that good ending, if he is getting back home. We got him in his pool this summer, like, we got him back to doing the things that he loves, but being there from really day one and helping guide that. And here are the recommendations. Our team talks to and works with all different people in the area of helping set up the stroke survivor and their family for a long-term success plan.
That that struck me because I understood. I went through when I first got a neurophysical therapist. They
Yeah.
put me on a water treadmill,
Oh, okay.
and within a month, I was walking at like 2.5 or 3, and I
Yeah.
started crying like a baby, and I'm
Right?
still getting choked up because it was like, wow, this
Yeah.
can be done. And that was at 6.5 years.
Isn't
And
that,
six
I mean,
months later, I was off the cane, walker, everything.
I love that for you, Ralph. Those are the moments that make it, our careers, really. And it's just like a helping you reach that goal, helping you do that. That's why we do this every day as neurotherapists is to get that yes moment and celebrate with you that you've
Yeah,
reached a new
yeah.
milestone. Yeah, that's
My
amazing.
wife used to say, before she was a nurse before for 45 years of pediatrics. And she
Oh,
always said, um, that she thought it was a calling, it wasn't a job, you
absolutely.
know. there's so many people out there that are looking for work, but are looking for a job but not work. And that's the calling part.
Completely
And I,
agree. That is exactly who I look for bringing on those people that are doing this because they were called to do this. This is not just a job for them. I say that I feel blessed that I get to do this. I don't even consider this a job, right? Like, yes,
yeah,
it's what my
exactly.
job is, but I love and our whole team, we love what we get to do every day.
Very cool. You cite highlights like therapies like Vivistem.
Yes.
What is that and how does it help recovery?
Fantastic. This is the way that the science world and research is going these days is incredible. So Vivistim is a new FDA approved device for chronic ischemic stroke survivors. So right now it's only approved for ischemic stroke survivors, which that's the blood clot kind. Um,
Right.
so if someone has had a ischemic stroke and they are 6 months and up. So what's great about this is there is no end date. You can have had your stroke 30 years ago and you can still be a candidate for this device. It is a um, vagus nerve stimulator. So this device has been being used with patients for decades, just for epilepsy and PTSD management. But they've recently found that it helps regain upper extremity function after an ischemic stroke. So, and I have seen it with my own two eyes. It works wonders. So this device gets implanted. The device itself, just the device getting implanted, isn't going to be a magic on-off switch. The key part that happens is when we pair it with that good neurotherapy that you should be getting, of that high intensity, high repetition. Right when you're doing a movement, the therapist is going to press a button and it's going to release neuromodulators into the brain from a vagus nerve stimulation that is going to optimize the brain's potential for recovery. So it's releasing all of these really great neuromodulators into the brain that's responsible for synapses forming and the new patterns and new connections being formed so that it improves your arm's ability to recover. We have had people that had difficulty moving their arm and they're playing in their bass guitar again. They're making dumpling soup. They're driving a skid loader and cutting the grass. And I mean, it is truly amazing to see the recovery happen, and it happens so quickly for these individuals.
As I understand it, we just got a surgeon approved up here in Oregon to do
Fantastic.
these in our
Yeah.
area anyway,
Yes,
central
it is an
to do
outpatient
these.
therapy procedure or an outpatient procedure. So you would have to, it looks almost similar to the size of a pacemaker being put in.
Right.
But you come home that day, normally it's about 10 to 14 days, depending on the surgeon, on, waiting, let the surgical site heal. And then you get to start what we think the fun part of the paired therapy. And it's 90-minute therapy sessions. So it is a lot of hard work that you've got to put in. But the outcomes that we have seen in-house are pretty incredible so far.
I've heard of stories of people regaining complete use of their
Really.
arms.
Yeah,
It's
and
a
I think
it's
it's important to note it's not an on-off switch. You're not going to get the
right,
device, we turn it on, and now
right.
your arm's moving. You've got to put in the work and do the therapy with it as well. But yeah, people have been having great results with it, and it's a wonderful thing for stroke survivors because there really hasn't been much for long-term upper extremity returns. So if anyone is interested in Vivistim, I say reach out to your local team and therapist and see if you could be a
Yeah.
candidate for it. Yeah.
Are there any other new technologies or rehabilitation methods that you're really excited about other than Vivistem?
Yeah, so Vivistim is one that's obviously a surgical implantation. There are the ones that I say are like the tried and true good neurotherapy is those 10 principles of neuroplasticity that we need to be implementing as therapists, and that for stroke and brain injury survivors, make sure that your therapist is implementing those of high intensity repetitions. With research, we should be getting 300 to 600 repetitions per session. That's what you need to be doing. Most clinics,
Oh,
most therapy sessions are getting like 30 to 40, 30 to 50. So, in really to optimize that recovery, it needs to be high repetitions of salient, that functional, important, task specific training. Those are the best things to be doing with therapy. There's a lot of different devices and NMES and upper extremity returns, many different companies, but they are all what I consider tools in the toolbox to add into the base of that good neurotherapy of implementing that high intensity task specific training.
How do you balance that with the high tech and more human-centered care?
Yeah, I think exactly that, Ralph. It's human centered. Looking at the person first and seeing what their needs are and where we need to focus and you know what are their goals and how can we tailor our treatment to what their goals are. And if it is using one of the higher tech pieces of equipment, we'll use that as a tool in the toolbox. If that's not appropriate for them, we gauge that and say, okay, we need to focus on this avenue first, and then maybe this might be added on. But it's really using kind of a multi-system approach to optimize that time window and ability for recovery of all different tools. It's not a one, cookie cutter approach for each person. Our approach is going to be vastly different for every single person because we're all different as humans and we all have different goals and motivations and recovery as well.
Do you, and it sounds like you do, but um, I didn't have, if I told a therapist in the beginning, I don't think this is working, they would work, and we kept doing it.
Mm.
It's, there's no limit. Is there a limit to when you say, you know what, this just isn't working? What do you think? Or is
When
that the
you say
communication we should be doing?
Yeah, when you say, this just isn't working, like the exercise isn't
Yes.
working, not
Yeah.
getting, yeah. And I think that's where, as therapists, we need to listen to what our patients are saying and listen to, not just verbally what they're saying, but what their bodies are doing too, and pay attention to that. And if we believe in, sometimes it's hard to see recovery happen because it's small. So sometimes when you're living it, you're not seeing it as much as maybe your therapist is. We see that flicker that came on of the wrist, but you're not moving the wrist fully, so you're not thinking that it's helping. Or, there might be different things, but at the end, I think it comes down to the therapist and the survivor communicating on like, hey, this isn't working. I want to switch. I want to do something different. Okay, what do you have in mind? Or I think that we should keep working on this because when you did X, Y, and Z, I saw that activation kick in, and that's where we really got to focus and drill home this activation. So it's the communication, but also respecting our patient's choice. Um, you know, again, everyone that we see is a human and they have the
Yeah.
right and autonomy to make their choices and decisions. And it's our job to respect and honor that. And we can give, as a therapist, I can give my opinion and insight and tell you why I think that we should be doing something. But at the end of the day, you're like, Kelsey, no. Like, okay, let's switch to something else.
Well, and I don't think a lot of patients understand that they can say that. They
Yeah.
think that just because this is what we're doing, this is what I have to do.
Well, and I think it's important for survivors to know why. Why is my therapist wanting me to do this? And as therapists, we need to tell our patients, hey, I want you to work on this because it is going to help with whatever their goal is. So tying it together, not that you're just arbitrarily being told, like, I want you to pick up these cones and move 5 cones from here to here. If you told me to do that, I would be like, I'm not really interested, right?
Yeah,
So
yeah,
knowing
exactly.
what the intent is and communicating that with each other.
Okay. I'm curious about caregivers and community. Number one, I was single, so I didn't have any care partners in the home.
Okay.
I lived by myself 6.5 years after, before moving up here. What advice do you offer caregivers who support someone at home?
So we have a patient advocate on our team who her whole role is to help support the family, the patient, but also the family as well, because it's a lot. Someone just went from being two separate jobs, or I think in every relationship you kind of have you assume your own responsibilities for things, and then something happens to the other person, and now that caregiver has assumed not only that other person's responsibilities but also taking care of that person. And that the task list, if you will, gets is never ending. And I think the best advice, and I fully recognize that this is not easy to do, but is to take time for yourself. Because if you're burnout, if you're hurt, you're not going to be able to help your loved one. And I think the other part of it is too, and this is hard, but let that person kind of struggle with things a little bit. Sometimes it's easier for us as caregivers, and I was a caregiver to someone as well. And it's, you know, you want to just help them. You want to do everything for them. I want to make it as easy as possible. I just watched my loved ones suffer this massive life-altering stroke, and I want to be there and I want to do everything. I'm going to put your shirt on. Let me feed you. Let me get this for you. But then that's not giving them the opportunity to get stronger and learn to do it themselves. So there's that balance there that is oftentimes really hard and challenging, not just physically, but I think emotionally and mentally too, is a really hard balance.
Yeah, yeah, I agree. And I see so many, not so many, but I do see some caregiver. I've seen some that do so much for the patient
Totally. I'm sure it's
that
out
they
of
don't ever
love,
recover.
and it's out of just love. And when you see your loved one go through something very tragic, you want to be able to care for them and provide for them and love them. And that is a heartless, or a wonderful thing to do for people. Heartfelt, I meant, thing to do
Yeah,
for people, but it can sometimes become it can limit their ability to physically do things for themselves. But that's a
hinder
extremely
recovery.
hard, yeah, that's a hard place. And I will never tell a caregiver, don't do that. Everyone has, their own dynamics and roles, and what works for some might not work for the other. But I think the biggest thing I always tell caregivers is take some time for yourself, even if it's just 5 minutes, in the morning or before you go to bed, to just, you know.
Yeah,
And don't be afraid to ask for help.
yeah, true. How important is community and social connection in the recovery process?
I think very big, especially when you've been at home for a while and you kind of get, and that's part of why, one of the reasons that we wanted to do an adaptive gyms is to help encourage that community relations. And truthfully, Ralph, it is one of my favorite things to go up to that clinic. And I might be there just dropping off equipment or doing, something, but to see the patients and the caregivers that are sitting in the corner and cheering each other on and cheering. They have that community there, and they're going through things together. And as healthcare providers, oftentimes we don't always have the same experience of that lived experience, stroke survivor experience. And being able to connect with people who do have that lived experience, I think, is an
Yeah,
invaluable opportunity.
great. What what areas do you currently serve, and do you have plans to expand that?
Yes. So we cover southwestern Pennsylvania right now. So that is all around Pittsburgh is where we are right now. We are and have been actively growing over the past 4 years and expanding our coverage areas. We are looking at expanding into other states as well. I've talked with some other therapists, but it comes down to finding the right therapist to continue this
Yeah,
in other states. But we do have a virtual consultation program where we can see anyone in the United States. So obviously we can't be there in
right,
person.
right.
Um, but we do have a virtual consultation program. It's a month-long program that we have set up, and we can work with anyone in the United States. So that's always an option as well.
How do they find out about that?
On our website, it's neuroaccessrehab.com. There's a button at the top that says virtual consultations, and there's a form that they can fill out on there with their contact information, and we'll reach out to them within 24 hours to kind of talk with them and see if it might be a good option for them or not.
How do insurance and payment options work for these kind of services?
Yeah. So for the company in general, we work with all different insurance companies, Medicare. We do have private pay clients as well. So as healthcare is in general, it depends on what your insurance plan is. So we take a look at that and see what the benefits are, what, your plan allows from a physical occupational speech therapy standpoint. And then we let people know that and can cover if hopefully it covers everything. If not, or there's visit limits, we discuss that with you and what out-of-pocket cost you might have. And we have different packages, pricing plans. Our patient advocate, again, Brittany, she's incredible. She helps people we will get people in contact with grant programs depending on the diagnosis to kind of help support if insurance does run out. So many different options. We try and find a solution that works for everyone.
Patient advocate, is that similar to a social worker that does those kind of things?
Similar, yeah. Brittany's not a licensed social worker, but very
Right.
similar, just kind of helping take the burden off the patient and caregiver's plate. One of the best things, and it's one of my favorite things that our team all worked together was um, a gentleman actually had a stroke, and he was always in charge of cutting the grass. And they came home, and the wife was like, I could cut the grass, but that was his thing. Like, I don't want to take that from him. And she was so busy that she's like, I need someone to cut the grass. It's getting way too long right now, right? Like this is knee-high grass. We're gonna need to cut this down. So our team worked and Brittany worked to get her in contact with like local lawn care agencies to know these are the trusted, here's this, really supporting and setting, if we can just take one thing off of their plate, one less thing that then they can have that 5 minutes to sit and breathe or to help them do their exercise or just have moments to themselves where they're not going to have to be, scrolling to find the lawn care agency or which caregiver agency is best or how do I set up transportation to get to the doctor appointment. She helps with all of those things.
Yeah, I'd asked that question because I wasn't aware of patient advocates because I had a social worker through the
Yeah,
agency I was working with. So,
very
and some
similar things.
people may not realize that. Excuse me. Sorry about that.
You are good. You okay?
Yeah, wrong throat. For families listening, what should they ask when evaluating rehab options?
I would, if you're going to be in a hospital-based setting or a skilled facility or rehab, seeing if they're a stroke center, a certified stroke center, I think is very important. There's a special designation that hospitals and rehabs can get if they have demonstrated excellence in stroke recovery. So checking for that. From an outpatient standpoint or a therapy standpoint, looking to see are they specialized in neurology? Are they specialized in neurologic conditions and stroke specifically? And look around and see what type of equipment's in the gym, like you mentioned, Ralph. If it's a really high mat table that doesn't move, they're probably not seeing a lot of stroke survivors or brain injury survivors. You need a table that can go up and down. Do they have equipment that you can use there? How many therapists or how many patients are the therapists seeing at a time? Are there people just all milling around the clinic and one therapist, or is it a one-on-one type therapy? Um, are they implementing neuroplasticity principles? Do they know what the 10 neuroplasticity principles are? And if they can't tell you what neuroplasticity is, probably not your place. Oh, I think you might be muted, Ralph.
I didn't know about all that. I just learned right now that there's 10 principles to it. I didn't know that. I'm
Yes.
gonna have to check that more out.
Yeah, and I can send you a link if you want to share it with people. We have little postcards that we'll give people that have the 10 principles of neuroplasticity on it. And then we have 2 PDFs, one that has the 10 principles of neuroplasticity, and one that has, this is like the therapy cheat sheet, I call it, like a therapy tip sheet. This is how all these 10 principles should be implemented into therapy. And if it's not happening, bring it up and say like, hey, why aren't we doing this? Or why am I not getting this type of therapy? We give this to people. I give this to many stroke survivors out in the community and let them know like, hey, if you're not going to work with us, totally fine. Go wherever you want to go. Just make sure that they're implementing these 10 principles, because this is going to optimize your ability to recover at whatever potential that recovery is. This is going to get you the best bang for your buck in your recovery.
Yeah, I definitely want to get that link. Let's wrap it up with a few quick questions.
Sure.
In one sentence, what makes NeuroAccess different from other rehab programs?
We provide patient-centered care, not financially driven care.
What's the number one challenge survivors face after leaving the hospital, and how do you help them overcome it?
I think access to resources,
Pardon?
and access to resources, knowing what stroke-related resources are out in the community, and give us a call. We help find those resources. If it's not us, helping kind of connect what that is. But I think that that's something big that someone has a stroke and then they send you home and say, good luck, right? It's like, well, who do I call? When do I call? Where do I go here? What about that? Like, there's no guidance most times with that. So, yeah, I think that's a big area for improvement in our healthcare system as well. One of
Definitely.
the many.
If a survivor feels like they've hit a plateau, or one of them jerk medical people tell them this is as good as it's going to get, uh, what's your go-to message for them?
I think don't give up hope. One of the biggest things that I found is specifically for stroke survivors, our healthcare system wrongfully strips hope from these individuals when they never should have. And it's not giving people false hope. I don't believe in false hope, but it's giving people the hope to continue recovery that was there all along. They just didn't have the proper resources and tools available to them at that time.
Great answer. Um, what final message of encouragement do you want stroke and brain injury survivors to hear today?
I think recovery is always happening. It just happens at different speeds, at different points in the recovery, but recovery is always happening.
Agreed. Now I agree. After so many years, and now it's like, wow,
Yeah,
I'm,
you are proof, Ralph, right? You said after
yeah,
6 years, you are
exactly.
walking, breathing proof that recovery continues to happen and happens at the higher pace when you have all the right resources in place.
Definitely. Thank you, Dr. Harris, for joining us today and sharing your insightful work NeuroAccess Rehabilitation is doing for stroke and brain injury survivors. For our listeners, you can learn more or connect with NeuroAccess at neuroaccessrehab.com. Are you also on social medias?
We are on Facebook and Instagram and LinkedIn. I'm learning all the social
Okay.
media things, but yes, we are on all of those.
Thank you, Stacy, sorry. Thank you, Kelly, so much. Um, this is Stroke Warrior Radio. I'm your host, Ralph Cortese, reminding you to keep moving forward because we are stroke warriors, achieving victories every day. Thank you, Stacy.
Thank you.